Cardiology is very mechanical, so in its most basic form, it's a pump that pumps fluid throughout the rest of the body. Whenever I was growing up on a small farm and ranch in the Panhandle, we always had to find ways to kind of tinker with things to get them to work better. And so I always enjoyed doing that whenever I was a young kid, sometimes to my father's dismay, but I enjoyed working on things and trying to get things to work better. And as I kind of grew up, I really enjoyed working with people more so than working with irrigation wells and farm equipment. And so I ended up going into medicine for that reason. And once I did get into medicine and got exposed to cardiology, there's a lot of the same concepts there, whether it's mechanical, electrical, valves, things like that. It all fits together very nicely in the heart and the cardiovascular system. So I chose to come to work to Covenant because, one, I think it's the best hospital in the region, and we are the primary cardiology group for this hospital. We are part of an integrated model where we can easily communicate with other physicians in Covenant, and so that makes caring for patients that are in the Covenant system so much easier. When I can easily communicate with your primary care doctor, your oncologist, your pulmonologist, it streamlines care very much. So we can get a lot of work done in a very short period of time. And so one of the things that I try to focus on is not necessarily just putting people on medicines or pills or doing procedures. We'll do all that, but we try to also work on other things, like trying to get you in the best diet that you can, trying to get you exercising if you can. And if those are problems, we try to figure out what are barriers to that would keep you from being able to do those things. Our group has provided an incredible amount of care to the people of this region for over 40 years. So joining this group is part of joining that legacy and being able to care for the people of Southern Plains, the Panhandle, and Eastern New Mexico. I really consider it an honor to be invited to this group to see what I can bring and add to that and continue to provide care for the people of this region.